So one of the things that I often get asked when I'm treating pelvic pain, and in particular chaps that are suffering from symptoms of hard flaccid, is what is their main driver of their symptoms. And a lot of people come to me thinking that it is to do with tight hip flexors, anterior pelvic tilt, underactive glutes, tight abs, something related to their back, something related to fascial connections throughout their body. And I think what's really important to point out is that symptoms of hard flaccid are nothing related to any of those things at all. So if you've got an anteriorly rotated pelvis, in my near 22 years experience, I couldn't even tell you what an anterior pelvic tilt looks like. It's not something that I assess. It's not relevant to hard flaccid. It's not relevant to pelvic pain. And this is always quite a difficult thing for me to explain to people. And what you have to appreciate is that your penile shaft is controlled by your parasympathetic nervous system, or your arousal, subconscious, non-voluntary centers of your nervous system. It's smooth muscle, so you don't have a direct control over it, and that's very, very important. So if you've got a tight fascia in your chest, or if you've got tight hip flexors or weak glutes, it's not going to make a blind bit of difference to what's going on in your penile shaft. The other thing that people tend to be really, really worried about is doing Kegals. Kegel is where you do a contraction of your pelvic floor. It's a bit like if you're voiding or taking a wee and you want to stop yourself mid-flow, you contract your pelvic floor quite hard. That's a Kegel. Now that's something that we do when we sit to stand, when we cough, when we sneeze, when we get out of bed, when we run. And so quite often, if you do a Kegel and you feel that your symptoms are made worse, it's very difficult for you to avoid that muscle activation throughout the course of your day. So what we have to do is we have to check you out on ultrasound, and we have to get a really good understanding of how your pelvic floor is actually working. Is it working to, because what often we find is that people who are terrified about doing Kegels are actually quite underactive. They're quite weak. Not weak to the extent where they have incontinence, but they can't do a really powerful voluntary contraction of their pelvic floor. And this is contrary to what a lot of people believe. They think that their pelvis is too tight. Well, your pelvic muscles are voluntary. So if they're too tight, then your pelvic muscles are receiving messages from your central nervous system saying, tighten up, tense up. And so whilst you have to learn how to disengage from that tension, you also have to learn how to contract those muscles again. Because the other important thing to think about is if your muscles are a feeling of tight most all the time, then the likelihood is that they are weak, and therefore they're not up to the job, and therefore they're going to spend a lot of time in a state of fatigue. And if that's happening, then of course your pelvic floor is going to feel tight, and you're going to probably struggle to do Kegels, or you might do a bunch of Kegels and it makes your symptoms feel worse. And that's probably because you've done them in a manner that isn't really regulated, and you need to learn how to rehabilitate them properly using some biofeedback. But yeah, that's hard flaccid and hip flexors. And just to stress that point, hard flaccid has nothing to do with hip flexor tension and nothing to do with anterior pelvic tilt. If you read that online, it's factually incorrect, and whoever's written it really probably doesn't understand anything about how your pelvic floor is constructed and how your nerves interact, which is fundamental. All the best.